Hello, I'm Nicole with Jenny and Brianna and Missy here, and we're going to go over how to prone a patient. The patients that we're likely going to be proning here are non-intubated patients. So you might ask yourself why you would place a patient in the prone position. When a patient's laying supine like this, their heart compresses against their spine and it increases the pleural pressure, which collapses the alveoli, which obviously you need for air exchange and gas exchange. So by putting the patient prone, it increases the volume of air present in the lungs at the end of expiration. It helps shift some of the lung water out, so some secretions coming out of the mouth is not going to be abnormal, and it helps increase oxygenation. And if the patient was on a ventilator, which again they're not going to be, it would decrease the likelihood of barotrauma. So again, the patients that we're going to be doing this on here are likely going to be awake, alert, able to use their call light if they would need it to let you know that maybe they need to turn. And then there's going to be this protocol once we, Jenny and some other staff members revise, will be pushed out to you guys so you can have something to look at to help you when you have to do this. Some contraindications are pregnancy. Obviously they're not going to be laying on their stomach. Increased intracranial pressure, any severe trauma, which a lot of these would fall under, a chest tube that potentially has an air leak, or any type of ventricular arrhythmias. So again, this will be pushed out to you so you can see this. So we have Missy here, and we are going to use the hover mat to show you how to prone a patient. There are different ways of doing it. You can use just sheets, but we found that this is potentially a little more comfortable for the patient. So without further ado, are you ready, Missy?
Yep.
Okay. It's probably a good idea. We thought to have somewhere between 3 to 5 people to help move a patient this way. The more the better, I think, at least to begin with. So Missy is laying on a hover mat here, and then we have a second hover mat that we'll use when we go to flip Missy. So right now, Missy has electrodes on here. She doesn't have a Foley, no chest tube or anything like that, but you would want to monitor for those things. So when we do go to flip her, you're going to change everything from the front to the back. We will have a diagram for you to look at as far as how to change the electrodes from anterior to posterior, but basically you're just going to mirror them. So when we pull Missy up, it'll just be mirrored electrodes on the backside. You would obviously want to take into account moving the Foley as needed so it's not pressed against any pressure points, and we'll go through that as well when we do this. So to start, we're going to pull Missy my way and we're going to prone her this way. So the first thing you want to do is you want to tuck the arm the way that you're rolling the patient. So Missy's going to be pulled my way, so her right arm is going to be underneath of her. So we're going to tuck her arm under there so that it stays with her as we move her. Okay, and I'll try to yell. This hover mat's kind of loud here. So which one does he have? Okay, so you want to prepare the patient by telling them that this is going to inflate. Don't tell them you're going to blow them up. We were told that by the hover mat rep. So Missy, this is going to inflate. You're going to rise up here. And then I'm going to pull Missy my way. And after you get her pulled all the way to one side, you're going to deflate the hover mat. Jenny and Bree tucked that hover mat underneath of her. And then they also tucked this second hover mat underneath so that when we roll her, she has a second one underneath of her.
And enough over here so she can lay right on it.
So at this point, we're going to inflate the hover mat again. And we're going to change the lead placement at this time prior to moving her. We would take the stickers off. And then we'll replace the stickers here. Okay, so we've placed the electrodes on Missy's back, and then we're going to go ahead and inflate the hover mat again. And then we're going to roll then at this point, since the patients that we are likely going to be proning are awake and alert, we'll go ahead and ask Missy how she's most comfortable here. They like you to put them in a swimmer position when they are intubated, and that would look like putting an arm up like this and then putting the same leg up on that side. Is that comfortable, Missy?
Yep.
Okay. And then at this point, if they want to have like a pillow between their legs here or under their arm up here or potentially under their belly here, then you can put those there for position. Obviously, before you leave the room, you'd want to make sure that the call light's in their reach, like maybe just right under their hand so they can push the button. Monitor their EKG rhythm prior to leaving the room, and then just make sure that bony prominences are not directly just on the mattress with pressure. So. And then since I'm going to pull Missy my way and we're going to have the hover mat expand here, I'm going to have Missy turn and face Jenny so that when the mat inflates, it doesn't go right in her face here. So, all right, are you ready, Missy?
Yep.
We'll inflate here. Oh, you're going to jump on that side.
No, I can help pull and then.
Okay. Okay, Missy, we're going to go ahead and inflate the hover mat again here. Yep. And then we would go ahead and reattach the leads. I usually like to grab just new stickers and put them on rather than try to pop them on the patient. And then just help the patient position for comfort. And again, leave the call light within reach.